Okay, welcome to a new podcast. Dr. Jose Almeida here. And today we're going to talk about the Emsculpt Neo. So, what is the Emsculpt Neo? It's a relatively new device that uses radio frequency and high FEM technology, and it's being used for body contouring. Now, the reason I'm speaking about this today is to educate more our patients and our gym members of this available device technology that we now have. We've been using it for over a year and it's quite popular. People are using this machine. And I've also used it, and I'll just, as I go through this, I'll give you a little bit of my experience. As those of you who've seen, a few of these episodes, I'm a vascular surgeon, but I just finished, I competed in bodybuilding for 15 years, 17 shows in 15 years. My last one was last year. I'm done now. But I've had a lot of experience with body contouring in that hitting the gym and dieting for bodybuilding shows. So that's part of what we do is manipulate body composition to maximize muscle and reduce fat. And that's what this device helps one do if you're not so inclined to hit the gym. So it's an alternative. I think of it more as a supplement. As we've emphasized a lot on this podcast, the key to health is food and exercise. As you've heard your entire lives, you have to eat correctly and still do some exercise. So this augments the exercise process while you're tuning in your dieting strategies. And that really is your macros, proteins, fats, and carbohydrates. And we've discussed this in previous podcasts, and we'll discuss it again. So that's not the focus today. So let's bring up some slides so I can go through this. And okay. So what is Emsculpt Neo and why should you try it? Just get my thing situated here so I can talk to you. Okay. So this study from the Cleveland Clinic, 80% of Americans don't get enough exercise each week. We know that to be true, and we've talked about the problems with chronic illness in this country and worldwide, mostly felt to be due to the standard American diet or highly processed food and lack of exercise. So according to the Cleveland Clinic, individuals should aim for 2.5 to 5 hours of moderate exercise per week, or 1.25 to 2.5 hours of vigorous exercise per week. Now, a lot of people don't do that despite the recommendations. So what I'm going to show you in this presentation is a new device with 4 30-minute treatments. You can lose some fat and gain some muscle in targeted areas, and perhaps even systemically, as I'll show you near the end of the talk. Okay, so Emsculpt Neo. It's a combination of radio frequency energy and high FEM. High FEM is high intensity focused electromagnetic energy, mouthful there. So radio frequency, you'll see it used now with microneedling. We use it in vein surgery that I do every day to contract the saphenous vein and close it. Electromagnetic energy is just using a magnet to generate current in a controlled fashion. So Emsculpt Neo is both of these together. It's a 2-in-1 procedure that combines electromagnetic energy and radio frequency energy. And when used on the abdominal wall, for example, is equivalent to 20,000 muscle contractions in 30 minutes. So what this does, it induces apoptosis of fat cells. So that means when fat cells are brought to a certain temperature, it triggers their programmed cell death. So they'll slowly kill some fat cells. That's why it doesn't all happen immediately, but that's kind of what we want. So I guess we got to advance over here. It is an FDA-approved device for breakdown of fat, which we call lipolysis, and for improvement of abdominal tone. So it can be used on the abdomen, buttocks, thighs, calves, and there's different paddles. This is the abdominal paddle. This is a machine, and it will give an increase in muscle tone. And there's no needles, no anesthesia required, no downtime. That's the beauty of this thing. It's truly non-invasive. As far as competitive and even older technologies, so this is the new one that we're talking about, the average fat reduction per patient in this study, about 30%. Now, the first generation device, about a 20% average fat reduction. Cryo or Emsculpt is something that I've tried, and I'll show you in a minute. Not quite as effective for fat loss. And of course, we're getting the bonus of muscle toning or growth, hypertrophy, in addition to the fat loss with the Emsculpt Neo. So this is me. I had herniated a disc in my back, probably, I don't know, 2010, doing squats, re-injured it in 13. And I started developing some atrophy of my lower back and just accumulation. I've always had the love handles, but I just couldn't get them down anymore, dieting for show. So I was getting desperate, wanted to look decent on stage. So I tried this Emsculpt, couple of treatments. They put paddles on each love handle, and you freeze it. And during the procedure, which was about an hour and a half each side, did not hurt at all. But when the paddles came off, there's a few minutes where it really hurts like an SOB until things settle down. But I didn't really, so the problem I had was fat accumulation and the laxity of the skin in the area. So even, you can see a little skin folding off my undergarments there. And of course, I'm getting older. I'm in my 50s here. I'm about to turn 60 this year. So this is about 5 years ago. So that's probably about 55 years old. So there's age-related changes that I'm wrestling with. But the point is, I tried cryo and didn't work for me. And I just went to the point of getting a plastic surgery buddy of mine to chop these off. He made incisions on both sides, removed the skin and the fat, and I healed from this quickly, and that really helped me going forward with the rest of the building competitions once a year. That the reason I did this, drastic maneuver. So yeah, I'm a little crazy like a lot of people out there. So radio frequency heating, the reason it works, so obviously, if we got a device on the skin, we don't want to burn the skin. But the reason it works, the conductivity or the ability for heat to pass through tissue is best in this case in the fat cells. So more heat is created in the fat than in the skin and in the muscle due to its lower conductivity. So the heat will travel quickly or more efficiently through skin and more efficiently through muscle. And I guess you could think of it as the fat cells acting more as a heat sink. So it's taking up the bulk of the heat. And that's where the damage to the fat cells that is desired. So the adipose tissue or fat tissue takes the brunt of the hit, which is what we want when we want to reduce subcutaneous fat in here. When exposed to temperatures above 42 to 43 degrees Celsius for a certain period of time, a large portion of fat cells initiate their programmed cell death. This is what we mentioned before as apoptosis. So this is the fat cell before heating, and the process that occurs is a shrinking and eventual death of the fat cell, which is desired in this case. This is what apoptosis is. Right here, apoptosis. Human histology study, 8 subjects, and biopsies taken at baseline, and again at 10 and 20 days after treatment, and they showed the apoptosis and lipolysis changes at 10 days and at 20 days. You can see here the defined cell structures, and 20 days after this, the loss of the structural integrity here. You see that the cells are disrupted, and then the body will break this down and reabsorb it. So this is the non-invasive breakdown of fat that occurs with the device in the subcutaneous layers. The high intensity electromagnetic energy portion of the device is shown here. This is the paddle. This is the high fem energy, and it's based on Faraday's law that I don't know if people took physics, but electromagnetic induction of changing magnetic fields produces electric currents. So magnets can produce electric currents. Thousands of electrical pulses are produced in a single treatment. This triggers muscle contractions because it depolarizes the motor neurons, or the nerves innervating muscles. And it leads to induction of thousands of muscle contractions, about 20,000 contractions in a single 30-minute session. So this is the electromagnetic energy, in this case, going through the skin, through the fat, and targeting the muscle, and the muscle contracts. It actually heats the muscle for a period of time to improve the blood supply, preparing it for the contraction. So it's a warm-up phase with this device also. The muscle gets heated up a couple of degrees for a couple of minutes, and then the actual contraction treatments begin. And that's enhances the high fem treatments. So, effects on the muscle tissue. Faster results in exercise. Studies show that 4 Emsculpt Neo treatments activate muscle growth, supporting cells to a similar, it would be the same as doing a 12 to 16 week resistance training program. Now, that's obviously probably in newbies, not advanced weight training. Sculpting of heated muscles due to the combination of the radio frequency and the high fem. It's the only muscle device in the world that sculpts that uses sculpting heating muscles for results. It's this dual action. It's the only one in the world with dual action, is what it's trying to say, RF and high fem. And then it leads to hypertrophy and hyperplasia. So hypertrophy is actually growth of the cell. Hyperplasia is increasing number of cells. So you get both in this case, and you get a muscle increase of about 25% after 4 treatments. So here's some of the studies by Hollis and group out of New York. Satellite cells. So for hyperplasia to occur, there's these cells outside the actual muscle cell called satellite cells that need to be brought into the area for formation of new muscle fibers. So this is the only device that I've seen where the levels of satellite cells increase by 30% at 2 weeks after treatment. And we also, when we're doing weight training or lifting, resistance training, it is known in previous studies that through biopsies that it is satellite cells that induce muscle cell growth. So this device does that. Histologic images showed hypertrophic fibers and signs of newly formed fibers, so hypertrophy and hyperplasia. Muscle temperature was between 41 to 41 degrees Celsius during the whole treatment, and the observed results were equivalent to a 12 to 16 week exercise program. So this is one of the studies where that previous slide came from. And these are just some pictures. So notice that it says results in as little as 2 to 4 weeks after the last procedure. So most of these that were taken for treatments, so one treatment once a week for 4 weeks, wait 2 to 4 weeks, and these are the types of changes. So you lose a little bit of fat in the abdomen and a little toning here. You see a little more definition. So it's not, these are, you can see the changes. The changes speak for themselves, but it's not, a drastic, change. It's all subtle, and I don't know the diet that this particular patient was on. I assume that they weren't going crazy eating processed food during this treatment interval. And in the buttocks, which in Miami is super popular, is Brazilian butt lifts, surgical butt lifts are huge down here. Women are doing a lot of these. This is non-invasive. So again, after 4 treatments, a few weeks afterwards, you see a little more tone in the gluteus muscle, a little lift, and some loss of the fat in the subcutaneous tissues. This one's, pretty obvious result. It's not that subtle. Anyways, just to show that there are, peer-reviewed, I found a few publications in literature supporting this device and its use. There were preclinical studies done in animals showing as the device was developing. Then there's, of course, safety and efficacy studies, and then the types of studies you just saw where we see some before-after photos. So I guess more than 500 patients and 30 investigators involved in the body of literature for Emsculpt Neo. So there is some science to support this stuff. After 3 treatments, this is an ultrasound study. So ultrasound we do in the office every day is just using sound waves. So this would be the skin, this would be the subcutaneous fat, this would be the muscle. So at 3 months, after 3 treatments now, not even 4, 3 treatments, 28% fat reduction. So from here to here, you see this was the fat layer before, a smaller fat layer after, and then a muscle increase of 24%. So this is a muscle layer before, and the muscle layer has now grown after. Patient satisfaction, 88%. Okay, the control group, no changes. So they did do it versus a control, which is the scientific method. MRI, magnetic resonance imaging study where you get to see the cross-section of the entire belly. Same type of thing, 30% fat reduction, 26% muscle increase. Now, in this case, you could also see the abdominal muscle separation shrink. So things got closer from here to here, and this equates to a reduction in circumference or a shrunken waist, which of course is a desired effect. This is the one in our Brickell office. Here we have 2 Emsculpt Neos, so you can actually put 2 paddles on the abdomen at the same time if you desire. We have all other paddles up here, so you can treat the arms, you can treat the legs, you can treat the back, and of course all FDA approved. and we do this in the Medi-Spa side of our office. So the Medi-Spa is called Miami Skin Spa, and out of the Miami Vein Center is my main practice. And then just to show you, this is me. So last year, prepping for a show, this is before, and I did 8 treatments, one each week. I didn't wait the 2 to 4 weeks before taking pictures, but you can see the improved definition that I got from the treatments. And of course, this is in conjunction with dieting. So in 8 weeks, I was in a cut phase. So that's losing 1 pound per week. Also, this is an 8-pound weight loss in addition to the Emsculpt Neo. So my results are a little biased from a strict diet on top of the treatments, but it just goes to show. I mean, I thought it worked. I think the pictures speak for themselves. So this is interesting. Visceral fat. We've talked about, I think, a couple of podcasts ago with our DEXA talk. So visceral fat is equated with, cardiovascular morbidity and mortality, or metabolic syndrome. So the fat inside the belly around the organs is really a bad actor. It causes inflammation. So what we're seeing here with Emsculpt Neo in this study, that visceral fat reduction also occurred. So it not only had a benefit on the abdominal wall or the subcutaneous fat and muscle, it actually works systemically by reducing fat around the organs. So again, we have a DEXA device in our office, which is a low, radiation. You just go underneath this emitter for 5 to 10 minutes, and we get these images. It's a body composition. It's the most sensitive or best device for following body composition that there is. So here you see yellow being fat. You can see the color changes for bone, muscle, and fat, and this would be the X-ray image. But we can track people. So what I want to do in my office, in addition to as we use this Emsculpt Neo, in addition to seeing the cosmetic changes of body contouring, I want to see if there's truly these health benefits with visceral fat reduction. So we also get a visceral fat number when we do a DEXA scan that I've explained 2 videos ago. So if you're interested in DEXA, just go back 2 videos. All right, so this is how the Emsculpt people advertise or market. Shape up with 4 sessions of Emsculpt Neo, engage in a healthy lifestyle, and then you can maintain your results with a quarterly boost. And we have that program here at our office. So I think the key is engaging in the healthy lifestyle. And this is a supplement, as I stated. All right, so that concludes episode 18. I hope you'd enjoyed it. Subscribe to our channel, give us a like if you like the content, and we will see you next time.